Most people will have experienced acute rhinosinusitis during the course of viral upper respiratory tract infection or common cold. And this is the most common infectious disease. Okay. And in adults, the 2 to 5 episodes are normal per year. And in children, 7 to 10 episodes per year are normal. Okay. So see, prevalence of the acute rhinosinusitis is too high. It affects 6 to 15% of total population. It increases, this percentage increases in the winter months, right? In the climatic variations, wherever the climate changes, right? And in the damp environments, and in the air pollution. Okay. There is a good evidence to support that the hypothesis that allergic inflammation and cigarette smoke, these are predisposing factors. Okay. Allergic inflammation and cigarette smoke, these are predisposing factors to the common cold or in general to the acute rhinosinusitis. As you may know, the common cold is caused by airborne viruses, right? But which viruses are these? These are mainly rhinovirus, coronavirus, okay? But other viruses are also there, which are not so common, but rhinovirus is too common. Yes, others are adenovirus, influenza virus, parainfluenza virus, okay, respiratory syncytial virus, and enterovirus. Okay, these viruses are common to cause the common cold. So what do these viruses do is they attach to the host cell. Let's say this is host cell and this virus will attach here. And you know, in the respiratory epithelium, we have the cilia, right? So this is cilia. So what they will do is they will disrupt the normal action of the cilia. Okay, they will disrupt the ciliary action. Okay, and due to that, these mucosa becomes congested. And the mucous glands which are present in the nose, they oversecrete. Yes. Now, due to this oversecretion and congestion of the mucosa, this mucosal congestion extends to the paranasal sinuses. Because first it was in the mucosa, but it extends to the paranasal sinuses. Right? And from these sinuses, the sinus ostia are likely to become blocked. So this is how they block the paranasal sinuses. Okay? Now what's the treatment? So the symptoms generally start to subside after a few days, but it may take 2 to 3 weeks to completely resolve. So that's why the first line treatment here is generally to await natural resolution. Okay, wait for it. But if you want to elevate the symptoms with medications, then oral analgesics could be given because sometimes the facial discomfort is too much. So analgesics can work on that, right? And sometimes the nasal obstruction is too much. For that, systemic or topical decongestants can be given, right? And if the patient has excess mucus discharge, in that case, saline drenches and some sprays can be prescribed. Yes? Okay. See, this is a viral condition. That's why antibiotics here are generally unnecessary. Yes? But of course, the antibiotics will be preventing the secondary bacterial infection, right? The patient can take it, but they have the minimal advantage but are more likely to induce a number of unwanted side effects such as nausea, vomiting, abdominal pain, diarrhea, and the most important, bacterial resistance. That's why in normal cases of common cold, antibiotics should not be prescribed. Okay. And in some cases, topical steroids can be prescribed because the resolution of the symptoms, if this condition is moderate to severe, only in that cases of acute rhinosinusitis, or if the patient has a bacterial acute rhinosinusitis, in that conditions, topical steroids can be prescribed. These are some sprays which the patient can take to resolve the symptoms.